Hello guys, Vanakkam and welcome to Metier International Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. Welcome back to Magic Pill session. As you all know that in Magic Pill session, we are discussing very important topic and the MCQs related to that particular topic. Not only that, we are discussing additional golden points. So in the last class, we have discussed about ABG interpretation and the strategy how to solve the ABG interpretation questions, right? And today class, we are going to discuss very important topic, most demanded topic from the student, that is CPAP and BiPAP. So let's begin the talk with your thought of the day. Our greatest weakness lies in giving up. Whenever you are facing any failure, immediately we used to give up, right? So the most certain way to succeed is always to try just one more time. Whenever you are feeling any failure, just try one more time. Without failure, we cannot achieve the success. So keep on trying. Definitely you can reach your goal. With this thought, let's start the session. As I mentioned already, step by step, CPAP and BiPAP, important MCQ and vital points we are going to discuss. So watch the video till the end. If you like the video, please like it, share it, and subscribe our channel. You are seeing the images here. It is related to CPAP as well as BiPAP. Okay, fine. So basically, what is CPAP and BiPAP? Without knowing this concept, you cannot enter inside the MCQ session. Okay, so let me give you a brief introduction about CPAP and BiPAP. This will make you to understand the important concept which is lying within the CPAP and BiPAP, guys. Okay, fine. So first, see, the machine is going to look similar. The CPAP machine or BiPAP machine, both are going to look similar. Okay, but the setting is going to be changed. What is going to be changed? The setting is going to be changed. In CPAP, only one constant pressure is going to be there. Only how many? One constant pressure is going to be there in the CPAP machine. Whereas in BiPAP machine, from the name itself, it is clearly saying that bi. Okay, bi means what? Two. Okay, so in BiPAP machine, two pressure is going to be there. How many pressure? Two pressure is going to be there. Okay, so basic difference between CPAP and BiPAP is one pressure is going to be there. One constant positive pressure is going to be there in CPAP, and two positive pressure is going to be there in CPAP. This is the basic difference between CPAP and BiPAP. Let's go in detail about the CPAP and BiPAP. See, what is the full form of CPAP and BiPAP? See, CPAP in a sense, it is called as continuous positive airway pressure. Single continuous positive airway pressure is keep on going to the patient. If there is a mask is applied for the patient, continuously one positive air is going to enter inside the nose. During inspiration and during expiration, only one constant air is going to, positive air is going to enter inside the patient nose. The key point what you supposed to notice here is during inspiration and during expiration, continuously one constant positive air is going to enter inside the nose. That is called as what? CPAP. Okay. Whereas BiPAP means two setting is there. Here also, positive air is going to enter inside the nose. There is no negative pressure. Only positive pressure is going to enter inside the nose. Okay. During inspiration also, the positive air is going to enter, and during expiration also, the positive air is going to enter. Same like CPAP. But the pressure changes will be there. Okay, in CPAP, inspiration and expiration will be there. In the CPAP machine, the constant pressure of air is going to enter inside the nose during inspiration, and during expiration, there is no change in the pressure. Whereas in BiPAP, there is a change in the pressure during inspiration and during expiration. Once again, I am repeating, during inspiration, high pressure of positive air is going to enter inside the nose, and during expiration, low pressure of positive air is going to enter inside the nose. Okay, so that is called as what? BiPAP. In CPAP, there is no change in the pressure. One constant pressure of air is going to enter inside the nose during inspiration as well as expiration. Whereas BiPAP, during inspiration, high level of positive pressure is going to enter inside the nose, and during expiration, low level of positive air is going to enter inside the nose. So two level or two setting is there in the BiPAP. This is the basic difference between CPAP and BiPAP, guys. Okay, fine. So the description is already given here. The pressure type, one constant pressure is going to be there during inspiration and during expiration. That is called as what? CPAP, continuous positive airway pressure. Whereas in BiPAP, two pressure is going to be there. That is inspiratory positive airway pressure. Positive airway pressure, that is inspiratory positive airway pressure during inspiration, and expiratory positive airway pressure during expiration. Okay, so on the whole, during inspiration, high pressure of air is going to enter, and during expiration, low pressure of positive air is going to enter. Okay, fine. So two setting is there in the BiPAP. Clear, guys? Fine. So main function, what is the use of CPAP and what is the use of BiPAP? See, CPAP, the main function is it is used to keep the airway open. Airway patency will be maintained in the CPAP. Okay, because of continuous positive airway which is entering inside the respiratory tract, the respiratory tract patency will be maintained. It acts like a splint and it will maintain the patency of the airway. Okay, so it is mainly used to improve the oxygenation. The CPAP main purpose is used to improve the oxygenation. Whenever the patient is suffering from hypoxemia or hypoxia, that time it will enhance the oxygenation, increase the concentration of oxygenation in the alveoli, okay, and maintain the patency of the airway. That is the main purpose of CPAP. There is no role in removal of carbon dioxide in the CPAP. Please underline the word. There is no role of removal of retained carbon dioxide by the CPAP. Okay, so the main purpose of CPAP is maintaining the patency and maintaining the oxygenation. That's it. Okay, whereas BiPAP, it is totally different. Whenever there is a chance for retention of carbon dioxide, please underline the word. Whenever there is a chance for retention of carbon dioxide, that time you have to use the BiPAP. Okay, so this is the main difference. For hypoxemia, only hypoxemia without retention of carbon dioxide, you have to go for CPAP. Hypoxemia without retention of carbon dioxide, go for CPAP. Hypoxemia with retention of carbon dioxide. With retention of carbon dioxide, you have to go for BiPAP. Okay, carbon dioxide retention is there, BiPAP. Only hypoxemia is there, CPAP. That's all. Okay, fine. The next one is indication for CPAP. See, obstructive sleep apnea. See, what is obstructive sleep apnea? You can see most of the obese persons or old age people, they used to do snoring in the night. During sleeping, they used to do snoring, right? So during snoring, what will happen? You know, the throat muscles, they get relaxed and it will obstruct the airway, upper airway. And what in particular time, the patient will agitated and they will awake. Okay, because the airway is obstructed by the throat. Because of the relaxed throat muscles, the airway is obstructed by the throat. So that throat obstruction will cause or make the patient to wake up. Okay, so that is called as what? Obstructive sleep apnea. Okay, so if you are applying CPAP machine for this person, what will happen? Continuously positive airway is going inside the upper airway as well as the lower airway. It will maintain the patency. It will not allow the throat muscles to obstruct the upper airway. Okay, so that's why we are using the CPAP for obstructive sleep apnea. Okay, clear with the concept? The next one is pulmonary edema. What pulmonary edema? Cardiogenic pulmonary edema. So what is cardiogenic pulmonary edema? Because of heart failure, there is a retention of blood in the lungs. So it will cause what? Sweeping of fluid from the alveoli, not from the alveoli, from the blood vessels into the alveoli. Once again, I will repeat, it is happening, pulmonary edema happen because of heart failure. Whenever there is a heart failure, the fluid will be retained around the alveoli or even inside the alveoli. That is called as what? Pulmonary edema. And it is caused by what? Heart failure. The heart failure is causing the pulmonary edema. Okay. So whenever the patient is suffering from cardiogenic pulmonary edema, that time the alveoli will be filled with fluid. Because it is edema, right? So definitely fluid will be filled in the alveoli. So that time what will happen? The exchange of oxygen and carbon dioxide, it will get affected. In order to remove this problem, in order to compromise this problem, so what we have to do, we have to use what? CPAP machine. So the CPAP machine, it will give heavy blow of air. So that heavy blow of positive air will go inside the alveoli and it will push all the fluid, whatever retained inside the alveoli, it will go out. You understand the concept? The positive airway, which is given by the CPAP machine, is going to enter inside the alveoli and it will remove the fluid, whatever present inside the alveoli, so that the exchange of oxygen and carbon dioxide will take place properly. So on the whole, mainly two indication is there for CPAP. The first one is obstructive sleep apnea and second one is pulmonary edema. Okay. On the other hand, BiPAP. BiPAP we commonly used, as I mentioned already, whenever there is a retention of carbon dioxide, we are supposed to use what? BiPAP machine. Okay, so it is the BiPAP is the one which is used to remove effectively the carbon dioxide. So what are the indication for using the BiPAP? Let's see one by one. COPD, as you all know, in COPD, the carbon dioxide retention is going to take place, right? So that is a well-known thing. And second one is obesity hypoventilation. The person who is very obese, they cannot breathe properly because of the vast surface area of the body, and the air whatever they are taking, it is not enough to compensate the cells present in this body. Okay, so obesity hypoventilation, dyspnea will be there in for patient who is having obesity hypoventilation. Okay, for those people also retention of carbon dioxide will take place. And one more thing, neuromuscular disease, the best example is amyotrophic lateral sclerosis. It is a neuromuscular disease where the muscles of the lungs is becoming relaxed. So it is not having the capability to remove the carbon dioxide. So retention of carbon dioxide will be there. So on the whole, one point you have to keep in mind, that is retention of carbon dioxide in various diseases like, COPD, neuromuscular disease, or even obesity, hypoventilation. For these people, we have to use BiPAP to remove the carbon dioxide effectively. CPAP only for oxygenation, BiPAP for removal of the carbon dioxide. Understand? So one more best example I can give, type 1 respiratory failure is there, means we have to use CPAP, and type 2 respiratory failure is there, means we have to use BiPAP. So as you all know, type 1 respiratory failure means what? Only hypoxemia, only oxygen is low. For example, you can take a disease condition like pneumonia. In that pneumonia, only oxygenation problem will be there. Okay, hypoxemia will be there. So that time we can use CPAP. Whereas type 2 respiratory failure like COPD, so here retention of carbon dioxide will be there. So that time we have to use BiPAP. Okay, so on the whole, this is the basic concept about the CPAP and BiPAP, guys. Okay, so with this concept, we have to go inside the MCQs. Okay, without knowing this concept, if you are going inside, means definitely there is no use at all. So that's why I have given this much explanation. So let's solve the questions. The first question is, a 62-year-old conscious male with COPD is admitted to ICU. Is ABG reveals? Okay, 62 years conscious male. Patient is suffering from COPD disease, and there is some ABG values also. pH is 7.32. 7.32 pH means it is acidosis. The normal pH is, as you all know, 7.35 to 7.45. So here the pH is less. It means the patient is suffering from acidosis. The next one is partial pressure of carbon dioxide is 58. What is the normal partial pressure of carbon dioxide? 35 to 45 mm of mercury, right? Whereas here it is 58. It is raised. Okay, so on the whole, we can conclude that even partial pressure of oxygen is 65. The normal is up to 100, right? 80 to 100. But here it is only 65 mm of mercury, so it is very low. Oxygen partial pressure of oxygen is low, but partial pressure of carbon dioxide is high. And bicarb, it is 28. The normal value of bicarb is 22 to 26, right? Whereas here the bicarb level is slightly increased. So on the whole, by seeing this ABG value, we can conclude that it is clearly showing that it is acidosis and the carbon dioxide level is high. So respiratory acidosis, and kidney is trying to compensate that. That's why the bicarb level is minutely, that is little increased. Okay, fine. On the whole, respiratory acidosis is there for the patient. Okay, so in this case, which of the following is the most appropriate intervention? So this is the question. Intubate and mechanically ventilate the patient? No, we cannot ventilate because the patient is conscious. Okay. And start BiPAP with inspiratory and expiratory support. We can think about that because there is a retention of carbon dioxide. The carbon dioxide, partial pressure of carbon dioxide level is high. So we can think about this. And start CPAP at 5 centimeter of water. See here, there is no problem with the oxygenation. There is a problem mainly, say, obviously the partial pressure of oxygen is decreased because of increased carbon dioxide level. Okay, so carbon dioxide level is higher. That is the main focus we have to do. Okay, so starting CPAP is secondary only. First, we need to start BiPAP because we have to remove the excess carbon dioxide which is retained inside the alveoli. Okay, and the last one is administer 100% of oxygen via the non-rebreathable mask. 100% of oxygen for COPD patient is contraindicated. Okay, so on the whole, which is the right answer? So only one key concept you have to think here. Always, I used to say that in every question, we have to find out the keywords. So here the keyword is retention of the carbon dioxide. So retention of carbon dioxide means immediately you have to think about what? BiPAP. So here the right answer is going to be what? Start BiPAP with inspiratory and expiratory support. Okay, so here the patient is suffering actually from COPD. It is coming under what? Type 2 respiratory failure. Definitely CO2 retention will be there. So we need to think about what? BiPAP only. No need to think about CPAP. So here the right answer is option B, start BiPAP. Start BiPAP. The clear explanation is given here. Just pause the video and read the rationale. Okay, fine. Let's go to the next question. A nurse is monitoring a patient on CPAP therapy at 10 centimeter of water for obstructive sleep apnea. So obstructive sleep apnea is the common indication for CPAP, and here we need to note the values, setting values. The patient becomes increasingly agitated with respiratory rate of 28 per minute. What is the normal respiratory rate? 12 to 16. Okay, some books says up to 20 also, but still here it is higher. That is 28 per minute is very high. And saturation dropping to 85. From 100, the saturation is dropping to 85. Complaints of dyspnea. So here you should know the setting of CPAP, guys. The normal value of CPAP in this machine, CPAP machine. Actually, you know, in CPAP machine, the minimum pressure value is 4 and maximum pressure value is 20. Minimum pressure value is 4, maximum pressure value is 20. And for this patient, the pressure what they have given, 10 centimeter of water. 10 centimeter of water is the pressure they have given. After giving this also, the patient is agitated and respiratory rate is high, saturation is decreasing, and patient is also complaining dyspnea. What we supposed to do now? So this is how the scenario question will be there in your exams. So here, what should the nurse do first? Increase the CPAP pressure to 15. Previously, the person is getting 10. Now they are telling to increase to 15. Remove the mask and apply nasal cannula. Reassess the mask fitting and check for air leak. Administer IV sedative for agitation. So among this, which is the right answer? See, the right answer is going to be option C. Always, whenever the patient is suffering from agitation, dyspnea, increase in the respiratory rate, even saturation dropping, the first and foremost priority is you have to check the mask for leaking or fitting. Okay, the rest of the things you have to do next. First and foremost thing, what you're supposed to do is you have to check the mask, whether it is fitting correctly. So it should cover the nose as well as the chin. Okay, whether it is fitting correctly as well as the leakage is present or not. This is the main focus you're supposed to do. Okay, guys. So on the whole, which is the right answer? Option C is the right answer. Reassess the mask fit and check for air leak. Okay, let's go to the next question. A patient with the cardiogenic pulmonary edema is started on CPAP at 8 centimeter of water. Already I have given the minimum and maximum level of CPAP settings, that is 4 to 20 centimeter of water, right? So that is the normal value of CPAP setting. Okay, and already I have explained about cardiogenic pulmonary edema. Because of heart failure, the patient is suffering from pulmonary edema. Alveoli is filled with the fluids. Okay, fine. So that's why we are giving CPAP to push the fluid out and maintain the oxygen exchange. Okay, fine. So now the CPAP setting, 8 centimeter of water is going on for the patient. After 1 hour, the patient respiratory rate is reduced from 30 to 20. It is a positive sign, and saturation improves from 32 to 95, and accessory muscles use is also decreased. All are positive signs. Okay, so what does this indicate? CPAP is not effective. No, it is very effective. Patient needs to be switched to BiPAP. Not at all required, because the patient is having cardiogenic pulmonary edema. It is coming under type 1 respiratory failure. For type 1 respiratory failure, we need to stick on to CPAP only. Okay, fine. The patient is improving with current therapy. Yes, obviously the patient is improving. Mechanical ventilation is needed immediately. Not at all required. Mechanical ventilation is not required because the patient is improving. So on the whole, which might be the correct answer? Yes, guys. Option C is going to be the right answer. Patient is improving with the current therapy. Okay. So the next question is, a 45-year-old male on BiPAP. So far, we have discussed about CPAP, continuous positive airway pressure. Now the question is all about the BiPAP, bi-level positive airway pressure. Okay. A 45-year-old male on BiPAP complains on abdominal bloating. Very important, repeatedly asked question, guys. Abdominal bloating means some air enter inside the abdomen, especially in the stomach. So the person is having bloating sensation, nausea, burping is also there. So the nurse notes air entering the stomach. What is the most likely cause and the best action? So BiPAP setting is the key point. So air is entered inside the stomach. So what is the most likely cause and best action? Air embolism called code blue, mask too loose, tighten the strap, gastric insufflation. Insufflation means entering of air inside the stomach. From high BiPAP pressure, notify to the physician. Normal finding with BiPAP, continue therapy. So which might be the right answer, guys? So here the right answer is going to be option C, that is gastric insufflation from high BiPAP pressure. See, high BiPAP pressure is given to the patient. That's why the air entered inside the stomach. So now we need to reduce the BiPAP pressure. Okay, and the BiPAP pressure, the normal value ranges from 8 to 20. 8 to 20 centimeter of water, whereas the CPAP 4 to 20 centimeter of water, right? Whereas BiPAP 2 variation is there in the BiPAP. That is inspiratory positive airway pressure, expiratory positive airway pressure. Please remember this. Inspiratory positive airway pressure, the normal value is 8 to 20 m of mercury. Sorry, centimeter of water, not m of mercury, centimeter of water. If you are having paper and pen, please make a note of it. Okay. So BiPAP 2 setting is there. Inspiratory positive airway pressure, the normal value starts from 8 to 20 centimeter of water. And expiratory positive airway pressure, the normal value starts from 4 to 20 centimeter of water. Please make a note of it. These are all the memory based questions they can ask in the exams. Okay, fine. So what is the right answer here? As I mentioned already, option C, the air, high pressure air is entering inside the stomach. So option C is the correct one, gastric insufflation from high BiPAP pressure. So we need to inform to the physician. The last question is, a 58-year-old obese male with a history of obstructive sleep apnea. Obstructive sleep apnea is the indication for what? Type 1 respiratory failure. But still, here what happened, they have started with BiPAP, okay, for acute hypercapnic respiratory failure. So the person is also having hypercapnic respiratory failure. Okay, that's why they have started with BiPAP. So his initial BiPAP settings are 12 centimeter of water and EPAP setting is 6 centimeter of water. In the previous slide only I have explained about IPAP setting value and BiPAP setting, EPAP setting value. IPAP setting value, the normal one is 8 to 20 and EPAP setting value, the normal is 4 to 20. Okay, so for this patient they have given 12 centimeter of water and EPAP is 6 centimeter of water. After 1 hour of these settings, the patient ABG shows pH is 7.29, that is acidosis. Partial pressure of carbon dioxide is 62, hypercapnic, heavy hypercapnic. Partial pressure of oxygen is 86, okay, it is almost near to 100. Saturation is 92, it is little less, but still not less than 90, fine. So here we need to focus on what? Acidosis. What acidosis? Respiratory acidosis caused by retention of carbon dioxide. So retention of carbon dioxide is there. That's why they have started with what? BiPAP with the setting of IPAP 12 and EPAP 6. So now the question is, after 1 hour of this setting, there is no improvement. Still there is a retention of carbon dioxide. After these settings in BiPAP, they have to improve, but here there is no improvement. Still the carbon dioxide is retained in the body. So what we supposed to do now? So this is the question. So what is the most appropriate nursing action? Increase the IPAP to 16. Already what they are having 12, but now increase to 16. Increase EPAP to 8. Already they are getting 6. Now increase to 8. Okay. Intubate and initiate mechanical ventilation. Decrease IPAP to 10 centimeter of water. So this is the question. So what will be the answer, guys, here? See, you understand the concept. Patient is having retention of carbon dioxide. That's why they started with BiPAP. And they are given the setting also, IPAP 12 centimeter of water and EPAP 6 centimeter of water. Okay. So still after this setting, 1 hour they have waited, but there is no improvement with removal of carbon dioxide. There is the carbon dioxide is still retained inside the body. So what we can do now to remove the carbon dioxide? The only option is increase the IPAP setting. What setting? Increase the IPAP setting. Always keep in mind IPAP, inspiratory positive airway pressure, is heavier when compared to expiratory positive airway pressure. So we need to increase the inspiratory positive airway pressure from 12 to 16. Okay, so that it will evacuate all the carbon dioxide which is retained in the alveoli effectively. Okay, so that's why we need to increase the setting from IPAP 12 to IPAP 16. Okay, so here the right answer is going to be what? Option A. Option A. Increase the IPAP to 16 centimeter of water. The explanation I have given here very clearly. So just read it out. Okay, so most probably most of the values are given here, so it will be little confusing. So watch the video 2 or 3 times again and again so that you will get a clear idea about what is CPAP, what is BiPAP, and what is IPAP, or what is EPAP. Okay, so that it will be easy for you to solve the questions whatever you are facing in the competitive exams. Okay, so thank you very much, guys, and if you are having any doubts anywhere, you can drop your message in the chat box, and all the best for your upcoming examination.